Welcome to this video. I'm Balama. So, what are the key lessons we need to learn through this pandemic? And mainly, uh, because of the second wave, this second wave is more hazardous and it have engulfed many lives than the first wave, and it have literally scrubbing our economic and our well-being that we have lost in the first wave, which we thought that it could be normal and we could lead a good life. But all that were left in stake. The new objective of every person today is to live a life, just to live a life, and to save himself or herself or his family or her family. So, what are the key lessons that we need to learn through this pandemic? Well, the very fact that I need to tell here is India spends about 1.75% of GDP every year in its health infrastructure, and it has planned to increase it to 2.25% by 2025. So we have about 5 years of time to increase it, and that's how nation works. We can't able to just pour all the income and revenue of a government into a single sector. It would lead into a catastrophic event. It would lead into a chain event if we don't spare all of our resources to all the departments that we have. So, what are the lessons we need to learn? Well, taking considering the population of India is the second most largest population, and the density of India is far more than China's. China's density is only about 125 per kilometer, and India is about 415. So, having 415 people per square kilometer, the spread of virus will be even more greater than China. China is now have recovered far more greater than any other nation in the world. The other nations which have recovered are US and Israel. So the key factor why US and Israel recovered, and the government have ordered and have told its citizen to not use mask. If you want to use mask, it's more about your convenience, but the government don't mandate its citizen to use masks. So what made these US and Israel and China to these are the nations which have first been hard hit by virus, and they are now freely doing all their activities, and their economy has been booming, and they are making a day-to-day life as a normal thing. But in our nation, it's not the it's just other side of a coin in our India. So what we have to do and what that nation did. Well, considering Israel, it's a small nation and the population is only about 70 lakh. With 70 lakh as a population, you could able to vaccinate all of them with the GDP and human development index they have, and the per capita income is far greater than India of Israel. So they have invented their own vaccine. I think they are the first one to invent their own vaccine, and they have produced it. They have all the infrastructure and technological amendments that need to be produce those vaccines. So they vaccinated their own citizen, and they are exporting to other countries right now. And what US did is even made deal with AstraZeneca, Moderna, Pfizer, Johnson and Johnson vaccines, and more of the vaccines that have been vaccinated in US is of private companies. But in case of India, both Covishield and Covaxin, which are the predominant vaccine being vaccinated throughout India right now, by the time this video is being posted, India has been ordered and signed government of the treaty between government and private company. It's not a treaty, kind of business agreement with Sputnik 5, which is a Russian vaccine, Moderna, Pfizer, and Johnson and Johnson, which are not yet been administrating in India, but Sputnik 5 is just administrated in Hyderabad. So what we are lacking is we are lacking behind the technology and capabilities we need to produce this virus. The first vaccines, the first vaccine we are producing is Covishield, which is not a new vaccine just made indigenously by our nation. It is a copycat of AstraZeneca. And the Covaxin virus, and the Covaxin vaccine, it is indigenously produced by Bharat Biotech. We need to really congratulate as a nation, as a third world nation, as a nation which is still considerably low in its human development index. We have done something appreciating, and the thing which many countries which are lower than our country, which are poorer than our country, are seeking help from our country. It is a great gesture, and it is a noble cause what we are doing. Okay, where our India is exporting to other countries through manufacturing our own vaccine, but the rate of production is far low than other nations, comparing other nations, and the rate of vaccination per million people is far low. Well, considering China, which is the largest population in the world, we have vaccinated about, I think, we have vaccinated 10 crore people in just 90 days. And for China, it took 101 days. So consider the pace of China, which is a developed nation which has great infrastructure, health infrastructure than us. We have done well than this nation, which is again appreciated indeed by our government and our own people. But the rate at vaccine produced and the rate at people vaccinated are much lower than consumer other nation, and the per million population which is being vaccinated is still low. So what need to be done in future? Well, we couldn't able to do just like that. What we have to do is, currently the hospital beds are low. Many people who have been severely affected by COVID virus have been administered into hospitals, and there are many places in India, even in cities, where availability of hospital beds are no more. So mysteriously people are dying outside the hospital, and oxygen supply to the hospitals are low. Before that, about 40% of the oxygen production from industries have been given to medical person, 60% to the industry production of steels. But now, because of this COVID pandemic and the surge in demand for oxygen, government had stopped the use of oxygen for steel plants and diverted the whole 100% of oxygen production towards medical consumption. But still now, this is a vulnerable situation going on in our country. We people have never thought that it would lead to a oxygen demand like this, but government thought and government even sanctioned. But because of a lack of governance between central and state, it had made that made a mystery, and the innocent are the people who don't know what are this. Even though the people are the one who are illiterate and not aware. So as the thing, what we need to do for now is we need to protect ourselves. We just not blame the government. We have to mask ourselves. We need to be maintain social distance. We need to protect ourselves by making ourselves comfortable in home and doing all the chores and contributing towards the government in a positive way rather than just blasting it. So I hope you would understand what we do. So the thing what we could do, which will create a positive impact, are spreading awareness, contributing to government and its rules and its regulation norms being imposed day by day, tracking the news, what and all happening all around us, and to help the needy one who might be our neighbor, who might be our relative, rather than helping the government such as PM GAP and CM GAP funds. Yes, it is okay to help them, but like Srishant said, it is more important to help our neighbor and relatives rather than helping the government itself. So thank you for watching this video, I hope you all be safe and do good.